Welcome to our final video in this menopause education series. In the first video, we talked about what menopause is and the changes that happen in your body. In the second video, we discussed the different treatment options available. In this final video, we will answer some of the questions patients ask most often about menopause and hormone therapy. These include questions about periods, pregnancy, blood tests, contraception, and the safety of hormone therapy. Our goal is to help clear up common misconceptions so you can feel more confident discussing your care with your healthcare provider. Frequently asked question number 1. I'm still having periods. Am I in menopause? If you are still having periods, you are most likely in perimenopause, not menopause. Perimenopause is the transition leading up to menopause. During this time, your hormone levels go up and down, which can cause symptoms like hot flashes, mood changes, or trouble sleeping, even though you are still getting your periods. Your periods may also change. They can become lighter or heavier, come closer together or further apart, or become unpredictable. Remember, menopause is officially reached only after you have gone 12 months in a row without a period. Frequently asked question number 2. What if I haven't gone 12 consecutive months without a period? Can I still take hormone therapy? Yes, you do not have to wait until you've gone 12 months without a period before talking to your healthcare provider about treatment. If symptoms like hot flashes, night sweats, poor sleep, or mood changes are affecting your daily life, hormone therapy may still be an option during perimenopause. In some perimenopausal patients, we may recommend low-dose birth control to help regulate hormones. The best treatment depends on your age, your symptoms, your medical history, and whether you are still having periods. Your healthcare provider can help decide which option is safest and most appropriate for you. Frequently asked question number 3. Do I need blood work for my hormones to diagnose menopause? In most cases, the answer is no. Menopause is usually diagnosed based on your age, your symptoms, and changes in your menstrual cycle. Blood tests often are not helpful because hormone levels naturally go up and down during perimenopause. A blood test taken one day may look very different from one taken a few weeks later. There are some exceptions. If you are younger than 45, or if you have had a hysterectomy, an endometrial ablation, or you are using a hormonal intrauterine device, your healthcare provider may order tests because bleeding patterns may not provide enough information. Frequently asked question number 4. Can I still get pregnant during perimenopause? Yes. Even though fertility naturally decreases with age, pregnancy is still possible until you have reached menopause. As long as you are still ovulating, even if it is not every month, you can still become pregnant. That is why it is important to continue using contraception if you do not wish to become pregnant. Many people assume that they are no longer fertile because their periods are irregular, but irregular periods do not necessarily mean pregnancy is not possible. Frequently asked question number 5. When can I stop using contraception? The answer depends on your age. If you are 50 or older, contraception can usually be stopped after you have gone 12 months without a period. If you are under 50, it is generally recommended to wait 24 months after your last period before stopping contraception. One important exception is if you are using hormonal birth control or a hormonal IUD such as Mirena. These methods can change or even stop your bleeding, making it difficult to know when you have actually reached menopause. In that situation, your healthcare provider can help you decide when it is safe to stop using contraception. Frequently asked question number 6. Do I still need contraception if I'm using hormone therapy? Yes, this is a very common misunderstanding. Menopausal hormone therapy, or MHT, is not a form of birth control. The hormone doses used to treat menopause symptoms are much lower than the doses used in contraceptives, so they do not prevent pregnancy. If you have not yet reached menopause and you are still ovulating, you can still become pregnant. If you are unsure which contraceptive method is right for you, please speak with your healthcare provider. Frequently asked question number 7. I've heard hormone therapy causes heart disease. Is that true? The answer depends on when hormone therapy is started. For most healthy people who begin hormone therapy before age 60 or within 10 years of menopause, it is generally considered safe. Starting treatment much later may increase the risk of heart disease for some people. It is also helpful to look at the numbers. Out of 1,000 women who never use hormone therapy, about 9 will develop coronary heart disease. Among women who use hormone therapy for about 5 years, about 10 will develop coronary heart disease. So while there is a small difference, the overall risk remains low for most healthy people who start treatment at the right time. This is one of the questions that patients ask most often. Frequently asked question number 8, will hormone therapy cause breast cancer? The answer is not simply yes or no. Your risk depends on the type of hormone therapy you use, how long you use it, and your own personal risk factors. To help put the numbers into perspective, out of every 1,000 women who never use hormone therapy, about 59 will develop breast cancer. After 5 years of combined estrogen and progesterone therapy, that number increases to 79. After 10 years, it increases to 92. These numbers are shown to decrease in people using estrogen-only therapy compared to those using combined estrogen and progesterone therapy. While the risk does increase with longer use of combined hormone therapy, the overall risk is still relatively low. Your healthcare provider can help you decide whether the benefits of treatment outweigh the risks for your individual situation. Frequently asked question number 9, will hormone therapy cause a stroke or blood clot? For most healthy people, the overall risk is very low. For example, out of every 1,000 women who never use hormone therapy, about 3 will have a stroke. Among women using hormone therapy for 5 years, it is also about 3. This shows that the difference in stroke risk is extremely small for most healthy people. Blood clots are a little different. Some forms of oral estrogen, meaning estrogen that's taken as a pill, can slightly increase the risk of blood clots. However, estrogen patches and gels appear to have a lower risk because they're absorbed through the skin instead of passing through the liver first. Frequently asked question number 10, what side effects can I expect? Most people tolerate hormone therapy well, and if side effects do occur, they are usually mild and often improve as your body adjusts during the first few months. Estrogen may cause breast tenderness, nausea, or headaches. Patches and gels can sometimes cause mild irritation where they are applied. Progesterone may cause bloating, cramping, mood changes, or drowsiness. Some people also notice light spotting or breakthrough bleeding when they first start treatment or after a dose change. This is often temporary, but if you are concerned about any side effects, it is always a good idea to speak with your healthcare provider. Frequently asked question number 11. What if I get bleeding while using hormone therapy? Light spotting or bleeding can happen when you first start hormone therapy or when your dose is changed. In many cases, this is normal and settles down within the first few months as your body adjusts. However, there are times when bleeding should be checked by your healthcare provider. You should contact them if the bleeding is heavy, if it continues for several months without improving, or if it starts after you've already been stable on your treatment for some time. If you are ever unsure whether bleeding is expected or not, do not hesitate to contact your healthcare provider. They can help determine whether any further assessment is needed. Frequently asked question number 12. Can I use vaginal estrogen and hormone therapy at the same time? Yes. In many cases, vaginal estrogen can safely be used together with menopausal hormone therapy. Systemic hormone therapy, such as pills, patches, or gels, works throughout the body to help relieve symptoms like hot flashes and night sweats. Vaginal estrogen works differently. It delivers a very low dose of estrogen directly to the vaginal and urinary tissues, helping treat symptoms like vaginal dryness, discomfort during sex, or frequent urinary symptoms. Some people find that hormone therapy improves many of their symptoms but does not completely relieve vaginal symptoms. In those cases, using both treatments together may provide better symptom relief. Frequently asked question number 13. How long will I need treatment? There is no single answer because everyone's menopause journey is different. Some people use hormone therapy for only a few years while their symptoms improve, and then they gradually stop treatment. Others continue treatment for longer because their symptoms return when they try to stop. For many people, continuing treatment is appropriate if the benefits continue to outweigh the risks. The most important thing is to have regular follow up appointments with your healthcare provider. Together, you can review how you are feeling and decide whether continuing, changing, or stopping treatment is the best choice for you. As we have discussed throughout this video series, menopause affects everyone differently. Some people have only a few mild symptoms, while others experience symptoms that have a much greater impact on their daily lives. If you have questions or concerns about menopause, do not try to figure it out on your own. Your physician, nurse, nurse practitioner, and pharmacist are all here to help. Together, you can discuss your symptoms, the treatment options available, the benefits and risks of each option, and decide whether hormone therapy or another treatment is the best choice for you. Thank you.